and this is the final class for organon. We will finish organon today, so it's going to be a long class because बहुत सारे एफोरिज्म आज पढ़ने वाले हैं 245 से लेके पूरा एंड तक। और इसमें क्या है, बहुत सारे एफोरिज्म जो है रिपीटेशन है, मतलब फिफ्थ एडिशन का अलग है और सिक्स्थ एडिशन का अलग है। सो आई विल स्किप दोस्त, क्योंकि ऑलरेडी मैं वो चीज़ फिफ्थ एडिशन में पढ़ा चुकी होंगी। बस हमें देखना है सिक्स्थ एडिशन में सेम चीज़ कौन से एफोरिज्म में है। So let us start with aphorism 245. So 245 से 251, what it is related to? It is related to repetition of doses, when you should repeat. So in 245, what Hahnemann is saying, that if there is amelioration, whether it is an acute disease or it is a chronic disease, if there is amelioration and that amelioration is perceptible, means the patient can feel and the physician can also see that the patient is improving, and the amelioration is progressive, slowly and steadily your amelioration is increasing, then it is very striking, means anyone who sees the patient, he or she can differentiate कि हाँ भाई ये patient improve हो रहा है and the amelioration is increasing. So if all these 4 points are satisfied, that means you should not repeat. It precludes any repetition of the medicine. So remember these 4 points regarding amelioration, whether it is a acute disease or it is a chronic disease. अगर हमारी medicine के prescribe करने के बाद amelioration is perceptible, progressive, striking and increasing, then there should be no repetition of the medicine. Then 246 deals with slowly progressive amelioration. अगर जो amelioration है वो बहुत slowly progress कर रही है, so what will happen? It will accomplish all the good in how many days? In 40, 50 or 100 days. Means amelioration तो हो रही है and there is no hindrance to the action of medicine. Medicine का action जो है उसके लिए कोई obstacle भी नहीं है. Means patient जो है कोई भी ऐसा food नहीं ले रहा which obstruct the action of medicine. कोई ऐसा mental work भी नहीं है उसके पास which will hinder the action of medicine. तो ये स्लो एमुलेशन कितने दिन में खत्म होगी, मतलब कितने दिन में सारा अपना अच्छा चीज अकम्प्लिश कर देगी? इट विल एस्टैब्लिश ऑल द गुड थिंग्स, मीन्स इट विल कंप्लीट द एमुलेशन इन 40, 50 और 100 डेज। लेकिन 100 डेज तो बहुत ज्यादा होते हैं। सो हाउ टू रिड्यूस दिस टेन्योर ऑफ 100 डेज? इसको रैपिड क्योर में कैसे बदलना है? Henneman has told 3 points for rapid cure. Very important. 3 points for rapid cure. कौन से aphorism है? 246. और ये 3 points of rapid cure कब चाहिए? When the amelioration is slowly progressive. So what are these 3 points for rapid cure? First of all, your medicine should be perfectly selected. That means it should be a homeopathic specific remedy for that particular case. It should be most suitable remedy for that particular case. Then it should be given in minutest dose, बहुत large dose नहीं देना है, and it should be repeated at suitable interval. So perfectly homeopathic medicine होना चाहिए, minutest dose होनी चाहिए, and repetition should be at suitable interval. Then इसका footnote. This is the longest footnote of any aphorism in organon. पूरे organon में जो सबसे बड़ा aphorism है that is of 246th aphorism. So यहाँ पे जो word लिखा हुआ है पहला, ये Latin word है sai non juvent modo ni nocia. इसका मतलब क्या है? If medicine does not do any good, then it should at least does not harm the patient. तो हमारी मेडिसिन ऐसी होनी चाहिए, अगर कुछ अच्छा नहीं कर रही है तो कुछ बुरा भी ना करे. सो इट इज रिगार्डिंग द ओल्ड स्कूल ऑफ मेडिसिन के लिए हैनिमैन ने बोला है कि वो कुछ अच्छा तो नहीं कर पाती है लेकिन बुरा बहुत कर देती है पेशेंट का. सो ही इज टेलिंग अगर अच्छा नहीं कर पा रहे हो तो किसी का बुरा भी मत करो. दिस इज रिगार्डिंग द मेडिसिन ऑफ ओल्ड स्कूल फिजिशियन. देन अगेन ही हैज यूज्ड द वर्ड मॉन्ग्रल सेक्ट. मॉन्ग्रल सेक्ट और कहाँ पे उन्होंने यूज किया है? 149 फुटनोट. एंड मॉन्ग्रल सेक्ट इज, what is the other name? Crossbreed dogs. Yes, very good. Those who mix allopathy and homeopathy practice at the same time. Then which potency has been recommended by Hahnemann for both acute as well as chronic disease. That is 30th potency is well enough for whether it is an acute disease or it is chronic disease. ये important question है. Then single dose is sufficient for the purpose of cure. चाहे वो young children है या फिर very delicate and excitable adults है. So he is telling single dose is enough. ये दोनों point याद रखने हैं. 30 potency is enough whether it is acute or chronic disease or single dose is enough. Then किस केस में सिंगल डोज इज नॉट सफिशिएंट वो भी उन्होंने बता दिया है. द क्रॉनिक डिजीज इन विच देयर इज अ लॉट ऑफ प्रोग्रेशन मीन्स ऐसी क्रॉनिक डिजीज जो बहुत ज्यादा प्रोग्रेस कर चुकी है, एकदम कॉम्प्लिकेशन में पहुंच चुकी है. इन दोज केसेस सिंगल डोज से कुछ नहीं होने वाला. एंड दोज क्रॉनिक डिजीज हैव आल्सो बीन एग्रावेटेड बाय इनएप्रोप्रिएट मेडिकेशन. पेशेंट ने बहुत ज्यादा मेडिकेशन भी कर लिया, कभी एलोपैथी भी ले लिया, होम्योपैथी भी ले लिया, आयुर्वेदिक भी ले लिया. सो बहुत ज्यादा मिक्स हो गई पिक्चर ऑफ द क्रॉनिक डिजीज. सो कौन सी क्रॉनिक डिजीज में सिंगल डोज से कुछ नहीं होगा? जहाँ पे बहुत ज्यादा प्रोग्रेशन हो गई डिजीज की एज वेल एज इट हैज बीन destroyed by the inappropriate medication. Then also in case of serious acute diseases, वहाँ पे भी single dose is not sufficient. So both these 2 points you have to remember. Then difficulty of dose cannot be solved by, जो हम करते हैं कि डोज की डिफिकल्टी को सॉल्व करने के लिए यंग होम्योपैथ स्पेशली ये तीनों पॉइंट करते हैं. सो हैनमैन हैज ऑलरेडी टोल्ड बार बार रिपीट करने से डिफिकल्टी सॉल्व नहीं होने वाली है. सो रिपीटिंग द मेडिसिन इन क्विक सक्सेशन will not solve your problem of the dose. Increasing the size of the dose also does not help. And prescribing the lower dynamization of medicine in large doses. हमने सोच लिया कि हम तो सल्फर 6 देंगे और रोज दे रहे खाने के लिए, सल्फर 6 फॉर 30 डेज. सो व्हाट इज टेलिंग कि लोअर डायनामाइजेशन को लार्ज डोज में देने से भी योर प्रॉब्लम ऑफ डोज विल नॉट बी सॉल्व्ड. व्हाई ही इज टेलिंग लाइक दिस कि अगर हम स्मॉल डोज को बहुत जल्दी जल्दी रिपीट करेंगे तो दैट स्मॉल डोज accumulates in the body and it behaves like a large dose and it harms the body. For example, 1 + 1 + 1 करके ये क्या होगा? It will be 3. So ऐसे ही ये एक स्मॉल डोज, एक स्मॉल डोज, एक स्मॉल डोज ये accumulate होके it will give a large dose. It will behave like a large dose and this large dose will harm the patient of the body, sorry, body of the patient. Then middle path एक बोला उन्होंने कि ये सब प्रॉब्लम सॉल्व करने के लिए एक मिडल पाथ है. सो मिडल पाथ क्या है? उसके लिए 3 फैक्टर्स यू हैव टू कंसीडर. फर्स्ट यू हैव टू कंसीडर व्हाट इज द नेचर ऑफ द मेडिसिनल सब्सटेंस, कि ये बहुत ज्यादा डीप एक्टिंग है या सुपरफिशियल एक्टिंग मेडिसिन है, एक्यूट डिजीज में ज्यादा अच्छा काम करती है, क्रॉनिक डिजीज में. सो यू हैव टू अंडरस्टैंड द नेचर ऑफ द मेडिसिनल सब्सटेंस. Then next thing that you have to consider is corporeal constitution of the patient. You have to understand the constitution of the patient and you have to know the magnitude of the disease. Deep rooted disease है या सिर्फ organic plane में है या functional plane में है. So you have to look after all these 3 points to make out the middle path for the solving the problem of your dose. Then to eradicate a chronic disease, we have to give 10 to 12 doses of sulfur in X potency. X means 30 potency whenever indicated. So, ऐसा नहीं है कोई भी chronic disease में सल्फर दे दिया. Wherever sulfur is indicated, so Hahnemann is telling कि कितनी डोज देनी पड़ेंगी? 10 to 12 doses you have to give. Then after every second or third dose of sulfur, ऐसे कोई भी केस जहाँ पे हम सल्फर यूज कर रहे हैं, after every second and third dose you have to give a single dose of Hippar-Sulf. Very important. Then although required, but sometime क्या होगा? सल्फर जो है बॉडी लेगी नहीं, बॉडी will start refusing sulfur क्योंकि बार बार सल्फर दे रहे हैं. So what you will do in such cases? You have to administer a small dose of Nux vomica 30 और Pulsatilla 30. और ये हमें कैसे पता चलेगा कि सल्फर अब बॉडी नहीं ले रही है? ऑल्दो पेशेंट को सल्फर ही इंडिकेट हो रही है, लेकिन अब सल्फर से वो रिस्पॉन्ड नहीं कर रही है पेशेंट की बॉडी, देन व्हाट यू विल डू, यू विल एडमिनिस्टर नक्सवोम 30 और पल्सटीला 30। और कैसे पता चलेगा कि अभी भी पेशेंट को सल्फर चाहिए? सल्फर के सिम्टम्स पेशेंट में नजर आने लगेंगे, लेकिन सल्फर इज नॉट एक्टिंग फर्दर, सो यू हैव टू गिव नक्सवोम 30 और पल्सटीला 30। Then if sulfur has been allopathically given means बहुत large dose में sulfur has been misused, then also body क्या करेगी, body will resist the action of sulfur. In such case you have to give mercury in olfaction. ये बहुत important question है. When sulfur has been allopathically given in large doses, which medicine is suggested by Hahnemann? So mercury, but in olfaction. Then for olfaction method, to whom Hahnemann has thanked? He has thanked to Dr. Grzelcyk of Karlsruhe. ये ग्रेसिलिक नाम याद रखना है. ओल्फेक्शन मेथड के लिए Hahnemann ने इन्हें थैंक यू बोला. Then silesia and sepia, whenever you are using, they should be repeated at longer intervals. And Hepar sulf 30 should rarely be repeated, and it should be rarely be repeated before 14 or 15 days. 14-15 दिन के पहले कभी भी हेपर सल्फ 30 रिपीट नहीं करना है. These are the directions given by Hahnemann, or these are the experiences of Hahnemann with doses or certain medicines he has described in aphorism 246 footnote. Then in acute diseases, medicines may be repeated at shorter interval. कितना शॉर्ट इंटरवल पे हम रिपीट कर सकते हैं एक्यूट डिजीज में? यू कैन रिपीट एट एवरी 24 आवर्स, 16 आवर्स, 12 आवर्स, 8 आवर्स और 4 आवर्स, और उससे भी कम घंटे में हम रिपीटेशन कर सकते हैं इन केस ऑफ acute diseases. Then at the commencement of cholera, very important question, which medicine is recommended by Hahnemann at the commencement of cholera? He has recommended camphor. 2 drops of camphor. And अगर बहुत ज़्यादा जल्दी रिक्वायर्ड है तो कितना जल्दी he has suggested, even at the interval of 5 minutes you can give camphor in cases of cholera, but only at the starting of cholera, only at the beginning or commencement of cholera for a speedy cure. Then what are the other medicine he has suggested for cholera when the cases of cholera has developed? तो याद रखना commencement पे C for commencement, C for camphor. But for the developed cases of cholera, he has suggested cuprum, veratrum album, phosphorus, arsenic, carboveg, all in 30 potency. Then in cases of pure syphilis, he is telling single dose of mercury 30 is enough, and sometimes 2 or 3 doses may be required at an interval of 6 or 8 days. या तो वो बोल रहे सिंगल डोज ही इनफ है, या फिर कभी कभी 6 to 8 days के इंटरवल पे you can give 2 or 3 doses. Then in very weak patient, you have to give medicine by olfactory method. And olfaction को भी कैसे करना है? एट अ शॉर्टर इंटरवल पे उसको रिपीट करना है. जैसे हम ओरल डोजेस को शॉर्टर इंटरवल पे रिपीट करते हैं, सॉरी इट शुड नॉट बी रिपीटेड एट शॉर्टर इंटरवल. जैसे ओरल डोजेस में Hahnemann ने बोला हेपर सल्फ को 14 से 15 डेज के पहले नहीं रिपीट करना है, तो ऐसे ही अगर हम olfactory मेथड से हेपर सल्फ दे रहे हैं तो सेम रूल इज एप्लीकेबल. इवन इन olfaction मेथड इफ यू आर गिविंग हेपर सल्फ तब भी उसको 14 से 15 डेज के बाद ही रिपीट करना है. देन एडिशनली व्हाट आई हैव एडेड दैट प्रीफेस ऑफ बोनिंगहसन रिपर्टरी ऑफ एंटीसोरिक, जो कि इट इज सेम एज फुटनोट ऑफ 246 एंड 288. जो भी हमने इस एफोरिज्म के फुटनोट में पढ़ा है वो सेम चीज रिपर्टरी ऑफ एंटीसोरिक में भी लिखी हुई है. 246 एंड 288 का फुटनोट वो वहां पे भी प्रीफेस में लिखा हुआ है इन द बुक ऑफ बोनिंगहसन, दैट इज रिपर्टरी ऑफ एंटीसोरिक. देन 246 के 6th एडिशन में क्या है जो अभी हमने पढ़ा, दैट वाज द 5th एडिशन ऑफ 246 एफोरिज्म. सो अगेन सेम थिंग इज रिपीटेड दैट एवरी न्यू रिपीटिशन शुड डेविएट समवट फ्रॉम द प्रीसीडिंग डोज. सपोज हम लोग क्या करते हैं, सपोज सल्फर है और 6th एडिशन जब भी मैं बोलेंगी मतलब आई एम रेफरिंग टू विच पोटेंसी, 50 मिलीसिमल पोटेंसी. So sulfur I will give in 0/1 potency or 0/2 potency. So what he is telling, every new repetition, जब हम सल्फर 0/1 बनाते हैं तो कितने डोज रहती है एक बार में, 16 डोजेस, और there are 8 doses. तो एवरी न्यू रिपीटिशन शुड बी डेविएटेड का मतलब क्या है, जब हम उसमें सक्शन कर देंगे तो इट विल बी डेविएटेड फ्रॉम द प्रीवियस डोज. सपोज आज ये फर्स्ट डोज पेशेंट ने ले लिया, देन व्हेन ही विल टेक नेक्स्ट मॉर्निंग द नेक्स्ट डोज, तो वो 10 सक्शंस करके ही विल टेक दिस डोज, दिस वाली. So it is deviated from this previous dose. Why this deviation of dose is required? Because vital force does not accept the unchanged doses. That is why in 6th edition or in the 50 millisimal potency, the dose should be somewhat deviated. क्योंकि अगर बिना सक्शन के ले लेगा तो इस डोज में और इस डोज में there is no difference, and the vital force does not accept any unchanged doses. I hope that is clear. You can write if you cannot speak.
Yes, ma'am. Yeah.
Okay. Now 247 5th edition. Repetition of doses. Chronic case में कब repeat करना है? In chronic cases you can repeat at every 14, 12, 10, 8 or 7 days. And in cases of acute disease, the repetition can be done at 24, 12, 8 or 4 hours. And in the most acutest conditions, you can repeat it every 5 minutes. ये same चीज अभी 246 के footnote में भी थी. So it is just a repetition. Then 247 6th edition में क्या है? सेम चीज जो अभी 246 के 6th एडिशन में था. इफ यू विल एडमिनिस्टर द सेम अनचेंज डोज, मीन्स अगर पेशेंट को विदाउट सक्शन लेने के लिए बोल दोगे, सो इट में प्रोड्यूस अननेसेसरी मेडिसिनल सिम्टम्स. पेशेंट ने क्या किया, आपने बोला था 10 डाउनवर्ड सक्शन करके ही नेक्स्ट डोज ले लिए, लेकिन उसने सक्शन नहीं किया, तो क्या होगा, अननेसेसरीली मेडिसिनल सिम्टम्स उसमें दिखाई देंगे. So you should somewhat deviate the next dose by potentizing it. और 50 मिलीसिमल में पोटेंटाइजेशन कैसे होगा, by giving 10 downward succussion. Then इसके footnote में क्या है, every repetition of doses of medicine should be changed in degree of dynamization, जो कि मैं शुरुआत से बोल रही हूँ, उसको 10 downward succussion करके वो हायर potency में चली जाती है. So such medicine may be repeated several times with beneficial effects. So this is written for 50 millisimal potency के 50 millisimal को हम बहुत बार repeat कर सकते हैं with beneficial effects. एक तो उसमें जो material quantity of medicine है that is very less, और हम क्या कर रहे हैं, एवरी डोज को थोड़ा सा डेविएट कर दे रहे प्रीवियस डोज से by giving 10 downward succussion. So you can repeat this medicine several times and it will give beneficial effects. But if you don't dynamize it or if you don't succus it before consuming, then what will happen? Medicinal symptoms will start accumulating in the body. Then 248 5th edition. Repetition until full recovery. जब तक full recovery ना हो तब तक हमें repeat करना है. So medicine can be repeated several times जब तक recovery ensues, till the recovery ensues, till the remedy ceases to good. जब तक वही remedy patient में अच्छा काम पूरा establish ना कर दे तब तक हम same medicine repeat करते रहेंगे. And कब तक मेडिसिन रिपीट करना है, when rest of the disease start demanding any other homeopathic medicine. Suppose I am giving sulfur to any patient, तो जब तक सल्फर का पूरा काम नहीं हो जाता तब तक मैं सल्फर ही रिपीट करती रहूंगी, एंड जब तक सल्फर का एक भी सिम्टम नहीं बचेगा और चेंज करने के लिए सिम्टम्स की टोटलिटी चेंज हो जाएगी तभी मैं सिम्टम के बेस में होम्योपैथिक रेमेडी भी चेंज करूंगी. सो व्हेन द रेस्ट ऑफ द डिजीज डिमांड्स एनी अदर मेडिसिन, तब तक मैं रिपीटेशन करती रहूंगी. जैसे ही टोटलिटी ऑफ सिम्टम चेंज होगी, आई विल चेंज द रेमेडी। देन 248 सिक्स्थ एडिशन, वेरी वेरी इंपॉर्टेंट। क्यों? क्योंकि इसमें शीन सिम्टम्स है, ये क्वेश्चन बार बार आता है। सो बिफोर गोइंग टू शीन सिम्टम, और क्या लिखा है वो देख लेते हैं। इन क्रॉनिक डिजीजेस मेडिसिन कैन बी रिपीटेड डेली और एवरी सेकेंड डे। फिफ्थ एडिशन में कब रिपीट करना है क्रॉनिक डिजीज में? एट 14 डे, एट 12 डे, एट 10 डे, एट 8 डे। बट in LM potency or 50 millisiemen potency, what he is telling, medicine can be repeated daily or every second day, एक एक दिन छोड़ के। In acute diseases, medicine can be repeated every 2 to 6 hours, and in very urgent cases, उससे भी कम hours में हम repeat कर सकते हैं। Then every repetition should be deviated or modified in degree of dynamization, और ये modification कैसे होगा? कैसे डोज को मॉडिफाई करते हैं इन 50 मिलीसीमल पोटेंसी?
10 downward succussion.
Yes, by the help of succussion and by daily repetition. अब क्या हो रहा है 50 मिलीसीमल में? पेशेंट इज टेकिंग द मेडिसिन डेली, सो व्हाट विल बी देयर at the end of the treatment? There will be homeopathic aggravation. So these symptoms are known as Sheen symptoms. So what is Sheen symptom? This is apparently increased symptoms which is caused due to excess of medicine. Everyday patient is consuming medicine, तो जब वो ठीक हो जाएगा तो पेशेंट तो एकदम अवेलेबल नहीं है डॉक्टर को, तो when the aggravation will start, then you will understand that these are nothing but these are Sheen symptoms. और ये क्यों आए? Due to the excess of homeopathic medicine. So then you will understand that the patient is on the road of recovery. और हम पेशेंट को बोलेंगे कि अब मेडिसिन डेली लेने की जरूरत नहीं है, यू कैन रिपीट द मेडिसिन आफ्टर every alternate day or after every 2 days or after every 3 days as per the requirement, or you can increase the cup. सपोज पहले मेडिसिन को फर्स्ट कप में ले रहा था, देन इसी में से एक स्पून अब सेकंड कप में डाल के लेगा, या फिर थर्ड कप में दे रहा था, सेकंड कप के एक टेबल स्पून मेडिसिन थर्ड कप में जाएगी, एंड फ्रॉम दिस थर्ड कप पेशेंट विल कंज्यूम. सो लाइक दैट यू कैन increase the cup or you can increase the number of days when the patient has to take the next dose. Then for such cases क्या करना है? I have already told. Longer interval पर repeat करने के लिए बोलना है. Then अगर हम 50 मिलीसिमल पोटेंसी को olfaction method में भी दे रहे हैं, then also succussion is required. 8 to 10 times succussion is required. देन फुटनोट में क्या है? हाउ टू प्रिजर्व द रेमेडी, ये क्वेश्चन आता है. सो सम एल्कोहल इज एडेड और अ पीस ऑफ चारकोल इज एडेड फॉर द preservation of medicine, and you can administer the 50 millismol potency by increasing the number of cups, because number of cups increases the dilution. So this is written in footnote to this aphorism. Then more details regarding Sheen symptom is given in 280th sixth edition. See, Sheen symptoms का और क्या मतलब है? Sheen symptoms means the patient is approaching towards cure, क्योंकि at the end of treatment ये आते हैं and they are due to the excess of homeopathic medicine. और क्या मतलब है इसका? Vital force no longer requires the remedy. The same remedy is no longer required by the vital force, and the vital force is now free from the natural disease. और उसको सिर्फ क्या है? Now the vital force is only suffering from the medicinal disease. और इस medicinal disease को कैसे हटाया जा सकता है? How will you remove this medicinal disease? शीन symptoms को कैसे हटाओगे?
By decreasing the dose.
मेडिसिन की क्वांटिटी कम करके.
Yes, very good. By increasing the interval of repetition और dilution बढ़ा के, number of cups को बढ़ा के, ठीक है. And your life principle और vital force is already free from natural disease. तो vital force में खुद में भी ये power है कि इस medicinal disease से वो खुद लड़ सकता है. So vital force will expel the medicinal disease itself. Then 249, antidote if new symptoms are seen after administration of medicine. So this is fifth edition. Fifth edition 249. अगर हमने कोई medicine दी and after giving that medicine, what is happening? New and troublesome symptoms are produced and these symptoms are not a part of the disease. हमने देखा कि जब हमने case checking की थी, so these symptoms were not there. So and they are very troublesome to the patient. Then what you have to do? You have to antidote the medicine. You have to antidote the medicine and you have to understand कि जो medicine हमने दी है that is inappropriate. That means that is not the most similar and suitable remedy. हमसे गलती हो गई. So गलती को कैसे सुधारना है? You have to antidote at once. अगर ये troublesome symptom बहुत ज़्यादा है then you have to antidote. अगर ये aggravation बहुत mild है then you have to do new case taking and you have to give new medicine. So antidote कब देना है? If the aggravation is very considerable and if the aggravation is mild then do new case taking and give prescribe new medicine. Then इसके footnote में क्या है? If medicine is appropriate then smallness of dose cannot forbid amelioration of disease condition. अगर हमारी मेडिसिन जो हमने सेलेक्ट किया इफ दैट इज एप्रोप्रिएट तो स्मॉल डोज देने की वजह से उसकी एम्लोरेशन हिंडर नहीं होती है. स्मॉल डोज इज एनफ टू क्योर दैट डिजीज और एनफ टू एम्लोरेट दैट डिजीज. एंड हेनिमन स्टेट्स दैट a true homeopath never requires an antidote in his practice. Why? Because वो हमेशा माइन्यूट डोज में प्रिस्क्राइब करते हैं और अगर मेडिसिन गलत भी हो गई तो माइन्यूट डोज देने से क्या होगा? जो एग्रावेशन होगी वो माइल्ड होगी. तो यू कैन गिव न्यू मेडिसिन आफ्टर रीकेस टेकिंग. So what he is telling, true homeopath never requires an antidote. Why? Because he always prescribes in minute doses. And this aphorism is equivalent to Kent's 10th edition. What is Kent's 10th edition?
When new symptoms appear after giving medicine.
Yes, when new symptoms start appearing after giving your first medicine, that is the Kent 10th observation. वहाँ पे भी सेम है, अगर new symptoms आते हैं then you have to antidote. So this is the correlation between Kent's 10th edition and this aphorism. Then 250, rectification of bad selection. How you will rectify your bad selection? So एक तो bad selection से क्या होगा? Wrong select करने से there will be in urgent cases after the lapse of 6, 8 or 12 hours क्या होगा? नए symptoms, new and troublesome symptoms will start appearing. Then how you will rectify your bad selection? You have to prescribe new medicine which is better suited to the disease condition than the previous medicine which you have prescribed. तो पेशेंट की कंडीशन कितने टाइम में डेटरेट होना स्टार्ट हो जाएगी? द पेशेंट्स कंडीशन विल स्टार्ट डेटरेटिंग आफ्टर अ लैप्स ऑफ 6, 8 और 12 आवर्स. एंड अगर बहुत ज़्यादा ट्रबलसम सिम्टम है तो यू हैव टू गिव एंटीडोट. एंड इफ द कंडीशन इज माइल्ड देन यू हैव टू गिव न्यू मेडिसिन एज पर 250. 249 में दोनों है. माइल्ड है तो गिव न्यू मेडिसिन और बहुत ज़्यादा है, कंसिडरेबल एग्रावेशन है तो देन गिव एंटीडोट. और यहाँ पे सिर्फ न्यू मेडिसिन की बात की गई है इन 250. देन 251. 251 is treatment of alternating symptom. Alternating symptoms has been discussed in 115. What are alternating symptoms? बोलो. Various paroxysms of primary action. Various paroxysms of primary action, and in most of the cases these alternating symptoms are exactly opposite to each other, like alternating constipation and diarrhea. But हमेशा exactly opposite condition होगी. This is not the rule. So अगर ऐसे alternating symptoms है, how you will treat them? First of all, he has given the example of those medicines जहाँ पे alternating symptoms होते. So the examples are RIBB. Rustox, Ignitia, Brainia, and sometimes Belladonna. These medicines produce alternating action. And alternating action is due to primary action, already told. And if no improvement follows after giving these medicines, then what you have to do? You have to give a fresh and equally small dose of the same medicine. Suppose मैंने रस्टॉक्स दी थी और कुछ नहीं हुआ, then मुझे पता है from the knowledge of Materia Medica कि रस्टॉक्स में alternating symptoms होते हैं. So what I will do? I will give again रस्टॉक्स in the same potency in the same dose. So ये question भी आता है. What will you do after prescribing a medicine which shows alternating symptom? So you have to give a fresh and equally small dose of the same medicine. Then footnote में क्या लिखा है? If you want to know more about alternating action, then go to the chapter Ignitia of Materia Medica Pura. Then alternating symptoms का description कहाँ पे है? 115 में है. And alternating disease which we read in last class, that is discussed in 232 aphorism. Then next set of aphorism 252 to 263 is regarding obstacles to recovery. जब हम किसी पेशेंट को क्योर कर रहे हैं तो what can be the obstacles? So 252 to 263 there are three types of obstacles that have been described. 252 से 256 में है signs of improvement and accessory circumstances which can act as an obstacle to recovery. 257 and 258 that is related to the physician. Physician जो favorite और unfavorite remedy बना लेता है, that is also an obstacle to recovery. Then the diet and regimen 259 to 263 that can also act as an obstacle to recovery. So let's start with 252 accessory circumstance which act as an obstacle to recovery. So if most closely selected antipsoric medicine does not affect cure, then it means it is a sure sign that there is some accessory circumstance in the background which is not letting this antipsoric medicine to affect the patient, which is not letting this antipsoric medicine to remove the disease. अगर हमने एक एंटीसोरिक मेडिसिन दी और कुछ भी नहीं हो रहा पेशेंट को, then you should surely understand कि ऐसा कुछ तो है पेशेंट के लाइफ में. There is some accessory circumstance, there is some cause which is not allowing this medicine to act, which is not allowing this medicine to remove the cause of the disease. So sure sign ये आता है. Sure sign is in 252. And what do you mean by sure sign? That means some accessory circumstance or some cause is there in the background which is not letting the action of the medicine to take place. So accessory circumstance, again it is discussed in 252 aphorism. Then 253 early signs of amelioration or aggravation in acute disease. What will be the signs of aggravation or amelioration in case of acute disease? So improved sense of well-being, अपने में अंदर से बहुत अच्छा लगने लगेगा पेशेंट को. This is the first sign of improvement in case of acute disease. And in cases of slight amelioration, what we will observe? A greater degree of comfort, increased calmness and freedom of mind, and higher degree of spirits. ये कब होगा? When there will be slight amelioration. First sign of amelioration क्या है? Improved sense of well-being. The general well-being, general sense of well-being of the patient will improve. And in case of aggravation, there will be exact opposite condition. Patient will feel helpless and the demeanor or the behavior of the patient will become very pitiable. उसको देख के हमें भी दया आएगी, ऐसा लगेगा. If there will be aggravation in case of acute disease. Then 254 is confirmation of early signs of aggravation or amelioration. So aggravation क्या है? New symptoms or increased original symptoms. जो patient के original symptoms है या तो वो increase हो गए या फिर new symptoms आ गए. This means aggravation. And what is amelioration? Diminution of old symptoms. Old symptoms जब intensity में कम हो जाते हैं, that means amelioration. And how you will confirm this? By the observation. By observing the patient, you will observe that whether there is aggravation or whether there is amelioration. But there are certain patients जो कि ये चीज नोटिस ही नहीं करते, या फिर अगर वो नोटिस भी कर लेते तो दे आर नॉट विलिंग टू कन्फेस कि उसको एम्लोरेशन हुआ या एम्लोरेशन हुआ. देन व्हाट यू विल डू? इम्प्रूवमेंट टेकिंग टू लॉन्ग टू अपीयर. ऐसा क्यों हो रहा है? बिकॉज द पेशेंट इज अनविलिंग टू कन्फेस. उसको समझ में ही नहीं आ रहा है कि एम्लोरेशन हुआ है या एम्लोरेशन. सो फॉर सच पेशेंट्स व्हाट यू विल डू, यू विल रीड आउट द whole case taking, you will read the previous. So when improvement is taking too long to appear, then what you will do? Why this improvement is taking a long time to appear? Because the patient is not willing to confess कि हाँ मेरे को होम्योपैथी दवाई से आराम मिल गया या फिर होम्योपैथी से एग्रवेशन हो गया. So for such patient you have to read out the previous record कि उसके क्या क्या symptoms थे. What are the new symptoms? Those you will add. What are the old symptoms जो ameliorate हो गए? You will strike out those symptoms. So this aphorism you can also call it as a follow-up. This is regarding the follow-up of the patient. And if there is no new symptoms that have developed, that means there is improvement in mind and disposition. And soon that amelioration you will see in the physical symptoms or in the whole disease of the patient. And if it doesn't do, अगर ऐसा नहीं हुआ, ना एम्लोरेशन है ना एग्रवेशन है, देन उसका मतलब है कि अभी मेडिसिन ने पूरी तरह एक्ट नहीं किया. सफिशिएंट टाइम हैज नॉट येट पास्ड फॉर द मेडिसिन टू एक्ट. So again you have to give placebo and leave the patient for some time. Then if the medicine was perfectly selected and improvement is taking too long time, परफेक्टली सिलेक्टेड होम्योपैथिक मेडिसिन है फिर भी बहुत टाइम लग रहा है इम्प्रूवमेंट होने से, तो दैट मीन्स देयर इज सम इंटरफेयरिंग circumstance or error. That means there is some obstacle to recovery in the patient's part. सपोज हमने थूजा दिया और थूजा को कुछ एक्शन ही नहीं हो रहा, तो पता चला केस टेकिंग में, वापस केस टेकिंग पता चला दैट पेशेंट इज स्टिल टेकिंग रॉ अनियन, ही इज ड्रिंकिंग अ लॉट ऑफ टी, तो कहाँ से इम्प्रूवमेंट होगा? So there is some interfering circumstance or error in the part of the patient, so that you have to rectify. And prolonged homeopathic aggravation because the dose was not properly minimized. तो दो कंडीशन हो सकती है अगर इम्प्रूवमेंट होने में बहुत टाइम लग रहा है. या तो पेशेंट का कुछ डाइट या रेजिमेंट में एरर है जिसको इंटरफियरिंग सर्कमस्टांस बोला है. इन द 6th edition, दिस इज एडेड इन द 6th edition, this word interfering circumstance. And या फिर there is a prolonged homeopathic aggravation. क्यों हुआ aggravation? Because हमने जो डोज दी थी that was too large और that was not properly minimized, तो इसलिए aggravation period चले जा रहा है और amelioration नहीं हो रहा है. So two conditions if still the medicine is not able to improve the patient. Then 256 is regarding appearance of new symptom. So again it is a repetition. अगर कोई new symptoms या new accidents patient में appear हो गया after giving your medicine, that means your medicine was not perfectly homeopathic. That medicine is not perfectly suited to the patient. And even if in such cases patient आके बोल देते कि हाँ मुझे अच्छा लग रहा है, तो you should not believe the patient. वो ऐसे शर्म के मारे पेशेंट बोल देते हैं कि हाँ ठीक है, ठीक लग रहा है, बट ऑन फर्दर इंक्वायरी व्हाट यू विल अंडरस्टैंड दैट देयर इज नो स्पेशल रिलीफ टू द पेशेंट. ठीक है. सो दिस aphorism is also equivalent to Kent's 10th observation. That means when new symptoms start appearing after prescription of first medicine. 256. Then 257 and 258, it is avoid hating any medicine or avoid favoring any medicine. So this is very, very important. 257 is avoid making favorite medicine. What is favorite medicine and why should you avoid making a favorite medicine? So he is telling physician should avoid making a favorite medicine. Why? Because क्या हुआ, मैंने फीवर के 5 केस देखे और 5 में ही ब्राइनिया वॉज इंडिकेटेड एंड आई गिव ब्राइनिया एंड पांचों के पांचों केस अच्छे हो गए. So what I have made a notion in my mind कि Brainia works better in cases of fever. So whenever the 6th or 7th or 10th case of fever will come, without any perfect inquiry मैंने क्या किया, Brainia दे दिया. So this is the meaning of favorite medicine कि fever का जो भी case आएगा I will give Brainia. So this is what Henneman is trying to explain, that the physician should avoid making the favorite remedy. इसकी वजह से क्या होगा, जो और भी अच्छी अच्छी मेडिसिन इंडिकेटेड होंगी वो सब स्किप हो जाएंगी मेरे माइंड से. सपोज उसमें यूपेटोरियम लग सकता था, उस फीवर के केस में बेलेडोना लग सकता था, या एकोनाइट यूज हो सकती थी. सो व्हाट आई हैव डन बाय मेकिंग दिस फेवरेट रेमेडी, आई हैव स्किप्ड दोज बेटर इंडिकेटेड रेमेडीज. दैट इज द disadvantage of making favorite medicine. And what is unfavorite medicine? This is just opposite of unfavorite medicine, which is discussed in aphorism 258. very important. इसमें क्या है, suppose मैंने 5 cases fever cases में Brainia दिया था and all the 5 cases are not improved, then what I have done, I have start to hate the Brainia कि अब तो मैं Brainia use ही नहीं करूंगी. So this is the meaning of unfavorite medicine. When you do not get favorable result by using some remedy, then you start hating that medicine. That is unfavorite medicine. So you should avoid such favoritism or hating any medicine, because this acts as an obstacle to recovery. Then 259 to 263 is regarding diet and regimen acting as an obstacle. How the diet and regimen of the patient can also act as an obstacle for cure. So first chronic disease का है, then acute disease का. ये याद रखना, पहले chronic का diet and regimen है, then acute का. Chronic is discussed in 260 and 261. Diet and regimen for acute disease is discussed in 262 and 263. So 259, minute doses of medicine are influenced by diet and regimen. So owing to the minuteness of the dose, all harmful substances having medicinal influence, कोई भी substance जिसका खुद की कोई medicinal power है, जिसमें खुद में कोई medicinal nature है, that should be removed from your diet. For example, ginger जो हम खाने में डालते हैं, या गार्लिक जो इंडियन फूड में यूज होता है, they have their own medical virtue. So those substances should be avoided from the diet of the patient because they have their own medicinal powers. फुटनोट में क्या है, इसका एक एग्जाम्पल है, जैसे कि सॉफ्ट ट्यून्स और फ्लूट आर ऑडिबल एंड अफेक्ट एंड इंस्पायर द टेंडर हार्ट. जब हमारा अच्छा मूड होगा, या फिर एकदम रात का टाइम है, या एकदम सुबह सुबह का टाइम है जब कोई नहीं जगा, तो सॉफ्ट ट्यून्स या फ्लूट की आवाज भी सुनाई देती है. बट इन द हसल ऑफ द डे, इन द हसल एंड बसल ऑफ द डे, उसमें क्या होगा, चाहे कोई चिल्ला भी रहा हो, चाहे कोई रो भी रहा हो, तो वो नहीं सुनाई देगा. So this is the same thing, because इतना ज्यादा साउंड है एनवायरनमेंट में, तो कुछ सॉफ्ट ट्यून तो बहुत दूर की बात है, किसी के चिल्लाने की आवाज भी हमें नहीं सुनाई देगी. This is what he has tried to explain by using this daily life example. Then 260 to 261 is diet and regimen in chronic disease. So what are the things to be avoided while the treatment of chronic disease? Why they should be avoided? Because they obstruct the recovery, they obstruct the path of recovery. So these are the same things जो हमने chronic disease में पढ़ी थी. कॉफी नहीं लेनी चाहिए, Chinese tea and other herb teas, beer, liquors, spirituous liquors, dishes of herbs and roots, stalks of medicinal plant, all of these things should be avoided while the treatment of chronic disease. Then Chinese tea और coffee, इन दोनों के लिए हैनेमन ने क्या बोला है? They serve to arouse the latent sora. ये एक लाइन याद रख लेना कि Chinese tea and coffee, they serve to arouse the sora, arouse the latent sora. Then और क्या क्या avoid करना है? Old cheese, regimen and other things to be avoided. और क्या avoid करना है? हीटेड रूम्स, वुलन क्लोथ्स नेक्स्ट टू स्किन, एकदम डायरेक्ट स्किन के कांटेक्ट में वुलन क्लोथ्स नहीं पहनने हैं। सेडेंटरी लाइफस्टाइल इन क्लोज्ड अपार्टमेंट्स, लॉन्ग सिएस्टा इन रिकम्बेंट पोजीशन, ये वाला खाए पिए सोफे पे ही पड़े पूरे दिन, ऐसा नहीं करना है ड्यूरिंग द ट्रीटमेंट ऑफ क्रॉनिक डिजीज। अनक्लीनलीनेस, अननेचुरल डिबॉचरी, सप्रेस्ड इंटरकोर्स इन ऑर्डर टू प्रिवेंट कंसेप्शन, बच्चा नहीं चाहिए इसलिए they are avoiding the sexual intercourse. Then dwelling in marshy districts, damp rooms and pernicious living. Henneman said that few of his disciples are forbidding many more things. वो बोल रहे हैं मैंने तो सिर्फ इतनी ही चीज अवॉइड करने के लिए बोली है, बट उनके जो फॉलोअर्स है दे आर forbidding many more things, but he is telling that this is not to be recommended. Then 261 things to be allowed in diet and regimen in chronic disease. क्या चीज अलाउ कर देनी चाहिए? Innocent moral and intellectual recreation. Then active exercise in open air, very important, in all weather, ये लाइन आती है. So इसको moral and intellectual recreation, that is healthy to the mind, वही वाली चीजें या उसी टाइप का recreation करना चाहिए. Recreation means कुछ ड्राइंग करने के लिए बोला जो उसके माइंड को डेविएट करे. अब ऐसा नहीं है कि पूरा दिन वीडियो गेम खेल रहा है. दिस टाइप ऑफ रिक्रिएशन इज नॉट अलाउड, which is innocent, which is beneficial for his mind. Then active exercise in open air in all weather, this is allowed. And suitable nutrition and medicinal food and drinks are allowed during treatment of chronic disease. Then come to the diet and regimen of acute disease. 262 very important. क्यों ये important है? Because the urgent desires of the patient in case of acute diseases, those should be fulfilled. Suppose किसी patient को fever हुआ है and that patient is demanding कि मुझे मैगी खाना है, तो उसको मना नहीं करना है. You have to give Maggi in moderate amount. Why? Because these things for some time palliate the patient. So you have to fulfill the urgent desires of patient in acute diseases. So now I am reading to fulfill the ardent desires of patient in acute disease, but this should not be fulfilled in which cases? Mental disease के patient के desires हमें fulfill नहीं करनी है. Why? Because they can arouse the patient और वो फिर से maniac behavior करने लग जाएंगे, delusion में चले जाएंगे. So for the patient who are suffering from mental disease, उन patient की desires fulfill नहीं करनी है. Then in fulfillment of such demands, सिर्फ वही वाली demand fulfill करनी है which are not giving harm to the patient. ठीक है? So you should take care कि these things are not harmful to the patient. सिर्फ वही वाली desires हमें fulfill करनी है. सपोज अगर पेट दर्द वाला पेशेंट मैगी मांग रहा है या फिर डायरिया वाला पेशेंट मैगी मांग रहा है तो नहीं देना है, बिकॉज इट विल एग्रावेट द कंडीशन मोर. सो यू हैव टू rectify that these fulfillments are not harmful to the patient. Then 263, why you should fulfill the desires of the patient of acute disease? Because they are palliative in nature. For a time being ये patient को आराम पहुंचाती है. एंड दीज ग्रेटिफिकेशन, उसको ये सब खाने से थोड़ा सा जो आराम मिलता है, जो ग्रेटिफिकेशन मिलता है विद इन मॉडरेट बाउंड्स, एंड इफ produces any harm that will be overcome by the medicinal substances. अगर उस फीवर वाले पेशेंट को मैगी खाने से थोड़ा बहुत हार्म होता भी है तो दैट हार्म विल बी ओवरकम बाय द मेडिसिनल सब्सटेंसेस. मेडिसिन देख लेगी वो थोड़ा बहुत जो उसको नुकसान पहुंचेगा मैगी खाने से या कोल्ड ड्रिंक पीने से जो थोड़ा सा नुकसान होगा, मेडिसिन विल टेक केयर ऑफ दैट नुकसान. देन वाइटल फोर्स दैट इज सेट फ्री बाय द मेडिसिनल पावर. वाइटल फोर्स को ग्रेटिफिकेशन प्रोवाइड करता है ये एक्यूट डिजीज में जो हम उसकी डिजायर को फुलफिल कर रहे हैं, एंड रिफ्रेशमेंट मिलती है पेशेंट को एक. देन ऑल्सो व्हाट आर द अदर थिंग्स यू हैव टू टेक केयर? पेशेंट के रूम टेम्परेचर भी उसके अकॉर्डिंग सेट करना चाहिए. द बेड कवरिंग ऑल्सो शुड ऑल्सो बी अरेंज्ड अकॉर्डिंग टू द विश ऑफ द पेशेंट. And patient should be kept free from all over exertion of mind and exciting emotions. एक्यूट डिजीज वाले पेशेंट को ओवर एक्सर्शन नहीं करना है और कोई भी चीज जो उसके इमोशंस को एक्साइट करते उस सब से यू हैव टू कीप देम अवे फ्रॉम सच कंडीशंस. देन फुटनोट में क्या है, डिमांड ऑफ पेशेंट इन एक्यूट डिजीज आर रेयरली इंजूरियस फॉर मेडिसिनल पावर. जो भी पेशेंट की डिमांड होगी इन केस ऑफ एक्यूट डिजीज वो मेडिसिनल एक्शन को हिंडर नहीं करेगी. एक छोटा एग्जांपल हेनेमन ने दिया है. फॉर एग्जांपल इन इन्फ्लामेटरी केसेस वेयर यू हैव गिवन एकोनाइट, और एकोनाइट के एक्शन को कौन डिस्टर्ब कर सकता है, वेजिटेबल एसिड्स कैन डिस्ट्रॉय द एक्शन ऑफ एकोनाइट. लेकिन ऐसा नहीं होता, पेशेंट डज नॉट डिमांड वेजिटेबल एसिड इन इन्फ्लामेटरी कंडीशन. पेशेंट इन्फ्लामेटरी कंडीशन में ज्यादा से ज्यादा क्या डिजायर होती है उसकी, ही डिजायर्स प्योर कोल्ड वाटर, and pure cold water will not disturb the action of aconite. So patient की desires उसी हिसाब से होती है naturally, that it does not harm the medicinal action, it does not hinder the medicinal action. Now 264 to 271, it is regarding the preparation of medicines in pharmacy in relation to organon, and preparation of medicine is known as pharmacopraxy. So before going to preparation, you should know what is genuine medicine and what is right medicine. ये question आते हैं, दोनों बहुत important है. Genuine medicine is that you should know your medicine is genuine. That means your medicine is of unimpaired strength. उसकी strength जो है उतनी होनी चाहिए जितनी होती है, उससे कम नहीं होनी चाहिए. So the physician should make sure कि उसके पास जितनी भी medicine है, those are genuine medicine and they have an unimpaired strength. Then patient takes right medicine. Patient सही medicine ले रहा है या नहीं, ये भी एक physician का ही responsibility है, physician का ही दायित्व है. This is the responsibility of the physician that your patient consumes right medicine. This is written in 265. Then 266, medicinal properties are maximum in raw state. So animal and vegetable kingdom की जितने भी medicine है, their medicinal power are strongest in their raw state. ये question भी आता है, very very important. Footnote में क्या है, all crude and medicinal substances have some medicinal power. ठीक है, crude form में भी, in the crude form also animal and vegetable substance possess some medicinal power, but इनकी medicinal power कैसे arouse होती है, when we do succussion or when we do trituration. So the process of making the medicines arouse their medicinal powers more. और इनकी medicinal powers कैसे diminish होती है, how are the medicinal power diminished, by pickling, by heating or by adding vinegar to them. So these things or these processes can diminish the medicinal powers. Then 267, very very important, it is regarding the use of alcohol. So juice of indigenous and freshly gathered plants is mixed with equal parts of alcohol to prevent fermentation. इंडिजिनस प्लांट या फ्रेशली गैदर्ड प्लांट, ये वर्ड को नोट डाउन करना है. इनका जो भी हम जूस निकालेंगे, सपोज 4 ml, so to this 4 ml juice of indigenous plants you have to add 4 ml of alcohol. Why you are adding alcohol? To prevent fermentation. And कौन सी स्ट्रेंथ वाला अल्कोहल यूज करना है? The strength should be sufficient to burn a lamp. This is very important. तो strength of alcohol को कैसे determine करेंगे? The strength of alcohol that is sufficient to light a lamp, वो वाला alcohol use करना है in the preparation of medicine. Then ये जो हमने mixture बना है, this mixture should be allowed to stand for 1 day and 1 night. 1 day and 1 night. So that means for 24 hours you have to stand that mixture of the medicine or medicinal juice and alcohol. Then अब क्या होगा, एक दिन तक अलाउड कर लिया, you should keep it away from the sunlight. एक वेल कॉक्ड बॉटल में कॉर्क से क्लोज करना है, एंड यू शुड कीप दिस मिक्सचर अवे फ्रॉम द सनलाइट because sunlight destroys the medicinal properties. Then there are special direction for some substances. For example, कोई विसिड या एल्बुमिनस प्लांट है, मतलब जिसका जूस बहुत गाढ़ा है, that there is thick juice of that plant, then you have to use double amount of alcohol. For example, ethuja and solanum. So they are having 4 ml juice. For example, ethuja and solanum. So how much alcohol you will add? सामने तो लिखा है डबल अमाउंट. Yes, very good. 8 ml of alcohol should be added for viscid and albuminous plant. Then O tempora O mors. This is very important. ये आता है. What is the meaning of O tempora O mors? O tempora O mors means oh the olden days they are no more. ये हेनेमन ने बोला है. क्यों बोला है? Regarding the use of alcohol for the preparation of medicine. He is telling that there is one author जिनका नाम है Buchholz, and what Buchholz is telling that Russians were the first to use alcohol in the preparation of medicine in 1812. इनका एक आर्टिकल आया है in 1812, and in that article he is writing that Russians were the first to use alcohol for preparing medicine. But Hahnemann की organ of medicine कब आई है? In 1810. तो अल्कोहल सबसे पहले किसने यूज किया मेडिसिन बनाने के लिए? हु यूज्ड अल्कोहल फर्स्ट टाइम फॉर द प्रिपरेशन ऑफ मेडिसिन?
Hahnemann.
Yes, Hahnemann. Very good. Hahnemann used. But what Buchholz is telling, that Russians were using alcohol for the first time for preparation. So by publication of these articles, you can easily understand who first used alcohol for preparing medicine. So for this instance, he is telling that O tempora O mors. भलाई का जमाना नहीं है, मैंने ये किया, but the credit is given to someone else. So he is telling, oh, the olden days, they are no more. Then come to the aphorism 268, preservation of exotic plants in powdered form. जो भी exotic plants collect करके लाओगे दूसरे country से, those should not be collected in pulverized form until and unless their genuineness is verified. Collect तो करना है powdered form में, but before converting them into powder, you have to verify whether it is genuine medicine or not. 264 genuine medicine. पहले हमें verify करना है कि ये असली है या नहीं, whether it is correct or not, whether it is having the unimpaired strength or not, that you have to verify. Then after that you have to make it in powdered form. So for exotic substances, they should be stored in perfectly dried state, and उसको perfectly dry कैसे करते थे? By the use of water bath. This is water bath. इसमें एकदम water निकल जाता है. The plant का water content is quickly separated by using water bath. Then come to aphorism 269, power of medicine becomes spirit-like by potentization. If you do potentization, the medicinal powers become spirit-like. That means you can only know the action of the medicine, but how that action is taking place in the body, that cannot be seen. And by the process of potentization, medicines which in their crude form had least medicinal power, now they become more powerful as medicine. So potentize करने से क्या होता है? Crude substances, जब वो crude थे तो उसमें they were having less medicinal power, but now when they are potentized, now they become now they have more medicinal powers. Now they become more powerful as medicines. Now 275th edition, preparation of centesimal potency. Centesimal potency को और क्या बोलते हैं? Very very important. Medicament आ गट्टा. गट्टा means क्या होता है? Drop, जिसको हम GTT लिखते हैं. Drops. GT means drop. ये फार्मेसी में आएगा. GT means drop. GTT means drops. So ये याद रखना है. So medicament आ गट्टा means centesimal potency. So How you will make centesimal potency? 2 drops of mixture of vegetable juice. So 2 drops of vegetable juice and alcohol. Alcohol के भी 2 drops. They are mixed and then they are added to 98 drops of alcohol. 98 drops of alcohol and they are shaken twice. 2 times उसको shake करना है. And this ये जो बनेगा, this is the 1C or this is the first potency. Now what you will do? You will take 1 drop of this. You will take 1 drop of this 1C, 1 drop, and you will mix 99 drops of alcohol. And again you will shake it 2 times. So what is this? This is 2C. This is second potency. Now when you will repeat this process 29 times, this process, then this process, and again for 29 times or 20, इसके बाद तो you have to go for 28 times. From 1C you have to go to 29 times, and if you prepare 2C then 3C, so like that total 29 times after 1C you have to do, and you will arrive at X potency or 30 potency or decillionth potency. So remember, decillionth means 30C or X potency means 30C. This is written in 270. How to prepare centesimal potency. Then footnote में क्या है? Potentization is not mere dilution. Potentization does not mean that you are diluting the medicine, but you are rubbing and shaking. You are continuously rubbing and shaking, which unfolds the medicinal power of a substance. So not only dilution, it is dilution plus rubbing and shaking. And Hahnemann had said that 10 succussion देने से क्या हो रहा था? It was giving rise to enormous power. The power of medicine was hugely magnified by giving 10 succussions. So he is giving only 2 succussions. Okay, so 2 succussions is advised in which edition? 5th or 6th?
Fifth edition.
Yes, very good. 5th edition, because we are talking of centesimal potency. So ये question बहुत important है. Hahnemann advised 2 succussions in which edition and 10 succussions in which edition. Then additional information, decillionth हमने जान लिया. Decillionth means 30C और कितनी dilution होगी 30C में? 10 to the power minus 60. ठीक है, 10 to the power minus 60, or you can write it as 1 by 10 to the power 60. If you are using minus, then it should be in numerator, और इसको denominator में रखना है तो 1 by 10 to the power 60. Then quintillionth fold means 15C, 10 to the power minus 30 is the dilution. Quadrillion fold means 12C, 10 to the power minus 24. Billion fold means 6C, 10 to the power minus 12. And million fold is 3C, 10 to the power minus 6. This is important for understanding. Then 6th edition of 270 is preparation of 50 millisimal potency. So 50 millisimal potency starts from mother solution, very very important. And mother solution किसको बोलते हैं? 3C. So how you will prepare 3C? 2 drops of vegetable, 2 drops of alcohol. Mix with 98 drops of again alcohol. Shake for 2 times. This is, ये कौन सी potency है?
3C.
This is 1C. अभी तो पीछे पड़ा. This is 1C. Then you will take 1 drop from this and you will take 99 drops of alcohol and shake it for 2 times. This is 2C. Then again from 2C you will take 1 drop and 99 drops of alcohol and shake for 2 times. This will make 3C. So this 3C will act as a mother solution for the preparation of 50 millisimal potency. Now how you will prepare 50 millisimal? you will take 1 grain of 3C. 1 grain means 65 milligram. ये क्वेश्चन फार्मेसी में आता है. 1 grain of 3C and you will mix it with 500 drops of mixture of water and alcohol in the ratio of 4:1. मतलब 400 drops रहेंगी water की and 100 drops of alcohol. In that you have to mix 1 grain or 65 milligram of 3C. Is that clear? Now what you will do? Take 1 drop from this. Again, now you will take 1 drop from this and you will add 100 drops of pure alcohol. Now you will give 100 succussions. 100 succussions you have to give against the leather bound book. एक बुक रहेगी लेदर की जिसका कवर लेदर से बना है. The cover of the book is made from leather and you have to give 10 downward succussion on that book of this thing. Sorry, not 10, 100 succussions, because we are preparing. While preparing you have to give 100 succussions. Now what you will do for the next potency? You will take 1 globule of this. यहाँ से you will take 1 globule and again you will mix it with 100 drops of alcohol. This is easy, just एक बार you will read it so you will understand. So again you have taken 1 globule from this thing which you have prepared and you will take 100 drops of alcohol and again you have to do 100 times succussions. So for preparation of next potency, every time you will take 1 globule, you will mix 100 drops of alcohol and you have to give 100 times succussion. Then what is the globule size for the preparation of 50 millismol potency? Very, very important. It should be 100 globules should weigh 1 grain or 100 globules should weigh 65 milligram. Then and 500 such globules will absorb 1 drop of medicine. ये जो globule हम use कर रहे हैं for making 50 millismol potency, 500 such globules will absorb 1 drop of medicine. Now what you will do? One such globule is mixed with 100 drops of alcohol, जो कि हम कर रहे थे बार बार. We were taking 1 globule from the previous thing and we were mixing with 100 drops of alcohol. और क्या हो रहा था? 1 drop of alcohol was absorbed by 500 such globules. तो dilution कितना हो गया? हम उस 500 में से 1 globule ले रहे हैं. We are taking 1 globule out of these 500 and we are mixing with 100 drops of alcohol. So the dilution comes to 1 by 50,000. Is that clear?
Yes, ma'am.
So that is why the 50 millismol potency is known as medicament U globule. क्योंकि ये globules को लेके prepare हो रही है. We are taking 1 globule from the previous one and we are mixing with 100 drops of alcohol. So that is why the name medicament U globule is given to 50 millismol. Although 50 millismol को dispense करते हैं water में, but 50 millismol is prepared from globules. वही globule, एक globule we are putting in 100 ml of water for dispensing. But for preparation purpose, we are using globule. That is why the name medicament U globule is given to 50 millismol. ये question आते हैं. Medicament U globule means 50 millismol. Medicament U gatta means centesimal. Then Hahnemann called it renewed dynamization or medicament U globule. These are the name given by Hahnemann to 50 millismol. 50 मिलीसिमल किसने बोला है? पियरे शिमिड ने. LM पोटेंसी में L है तो रुडोल्फ फ्लरी, 2 बार L आ रहा है इनके नाम में. जोस्ट कुंजली, कुंजली K फॉर कुंजली और K फॉर कुंजली, क्यू पोटेंसी, तो का मैच करना है, क्यू पोटेंसी जोस्ट कुंजली, ये क्वेश्चंस भी आते हैं, हु गेव द डिफरेंट नेम्स ऑफ 50 मिलीसीमेन. Then 271 fifth edition is regarding trituration. How you have to do trituration. So trituration, first of all, you have to know for which substances trituration is done. It is done for dry drug substances like metals हो गए, minerals हो गए, petroleum, phosphorus, juices of plant that is obtained only in dry states. ये example याद रखने हैं. Dry animal substances, neutral salts, etc. So all these are the example of dry drug substances, and for dry drug substances you have to do trituration, and all these dry drug substances are first to be triturated up to 3C. और 3C तक कैसे बनाएंगे, जो कि हमने 270 में पढ़ा, 3C वहां तक बना लिया, and you have to convert it in the powdered form. Then 1 grain of that powder, that is to be dissolved and potentized up to 30C. ठीक है, 1 grain लेना है and 99 drops of alcohol, 4C बन गया. Then again 1 grain from 4C and 99 drops of alcohol. So up to 30 you have to go for preparing the 30 potency. Then footnote is preparation of homeopathic medicine. Materia medica pura में कौन से drugs में है? In the arsenic chapter and in the pulsatilla there are details regarding the preparation of medicine. Then 271 sixth edition. Sixth edition में Henneman is telling physician must prepare the medicine himself. So the physician uses fresh juice for the preparation of medicine. What he does, he takes 1 grain of medicinal substance with 100 grains of sugar of milk and brings them to 1 millionth trituration. उसको 1 millionth trituration तक लेके आना है. Then this medicinal substance is mixed in solution of water and alcohol and then it is shaken. So what is 1 million? Again you just see 1 million trituration. This is 3C. 3C tak you have to bring it till 3C. Then from that 3C, what you will do? You will take 1 grain from 3C and you have to take 100 grains of sugar of milk. So 100 grains of sugar of milk means 65 into 100. 1 grain में 65 milligram है. So it is 6500 milligram. ऐसे करके करके you have to make the 3C potency. Then this medicinal substance is mixed with a solution of water and alcohol. Water and alcohol का ratio कितना होना चाहिए? What is the ratio of water and alcohol?
1:4.
4:1. पानी ज्यादा था ना, 400 drops of alcohol, sorry, water and 100 drops of alcohol. In this ratio, in this solution you have to mix. Then social medicine, very very important, यही question आता है इससे. What is social medicine? Henneman is advising that the state should provide homeopathic medicine to the homeopathic physician at free of cost, and it should be distributed to the patient, whether it is a rich patient or whether it is a poor patient. It is distributed to the patient at free of cost. So this is the concept of social medicine or social welfare. Then 272 to 285, it is regarding the administration of medicine or routes of administration. उसको क्या बोलते हैं? Pharmaconomy. Pharmaconomy is routes of administration of medicine. ये आता है pharmacy में. So 272 से लेकर 285 regarding of what they are telling that कि proving तो एक बार में एक ही medicine की हुई है. So how can we give more than one medicine at a time? We do not know their combined effect on the body of human being. So basically किसने oppose किया इसका? Henneman's disciples were the one who opposed the idea of giving two medicines at a time. And which medicine is curing? वो भी इस चीज से नहीं पता चला था. You cannot know when you are giving two medicines at a time. You cannot know that which medicine is helping in recovery of the patient or cure of the patient. So that is why Hahnemann again wrote the same things to AGD, and AGD also agreed that कि नहीं, only simple single medicinal substance should be given at a time. We should not prescribe more than one medicine at a time. Then 272 sixth edition. It is regarding the globule of medicine to be dissolved in water before administration. Why you should dissolve the globules of medicine in water before administration? Because this enhances the power of the medicine. इससे medicine की power increase हो जाती है. And when you dissolve the globules and stir them well, अच्छे से उसको हिला लिया, then you have consumed, then it touches many nerves at a time. एक बार में बहुत सारी nerves को touch कर लेती है medicine. लेकिन अगर हम globule लेते हैं, so the number of nerves touched is less. That is why it is beneficial to dissolve a medicine in water before consumption. और इसके footnote में क्या है? If you protect the medicine from sunlight, from heat, then the medicine can maintain its medicinal powers for many years. So you should protect your medicine, or you should keep your medicine away from the direct contact of sunlight and heat. Then 273 is regarding no doubt over prescription of single simple medicinal substance. Why? Because nature also supports the same. जब हमने देखा नेचर भी एक ही मेडिसिन, मतलब एक ही डिजीज को क्योर करने के लिए एक ही डिजीज भेजती है एक बारी में. सो नेचर इज ऑल्सो सपोर्टिंग दिस रूल दैट only one simple and single medicinal substance is should be used for a single time, because nature was also sending only one disease for curing one natural disease. So this rule of one is also seen in nature. So you should not doubt कि एक medicine देंगे तो cure नहीं होगा. Then 273 is regarding prescription of single simple medicine according to 6th edition. सेम चीज है जो अभी हमने डिस्कस किया. जस्ट कम टू द फुटनोट. फुटनोट में क्या है? मेडिसिन प्रोड्यूस्ड आर्टिफिशियली बाय केमिकल रिएक्शंस, दे आर नॉट सिंपल सब्सटेंसेस. ये क्वेश्चन आता है. Alkaloids which are extracted by chemical processes are also not simple substances. तो ये क्वेश्चन आता है, all of the following are simple medicinal substances except, एक ऑप्शन वहां पे देखना alkaloid लिखा हुआ, तो alkaloid will be the answer to that question, because alkaloid को extract करने के लिए बहुत सारे chemical processes से पास होना पड़ता है. So alkaloids are not regarded as a simple medicinal substances, as well as the medicines which are produced artificially are also not the simple substances. Then 274 is complex means. What is complex means? It is saying that when the simple and single medicine is sufficient, then why you are complexing your cure? Why you are giving more than one medicine or two or three medicine at time? You are making your method of cure as a complex process. So this complex means should be avoided. And for this thing he has written down, ये complex method क्यों नहीं use करना है? Because already I have told you, we know the action of one medicine, because while drug proving हमने एक ही medicine को prove किया था. So we do not know the combined effects of these two or three medicines. So that is why you should avoid giving two or three medicines at a time. And on the other hand, when a single simple medicine is used, in worst cases, अगर हमने सिंपल और सिंगल मेडिसिनल सब्सटेंस यूज किया है और कुछ भी कारण ऐसा हो गया कि न्यू सिम्टम्स स्टार्ट अपियरिंग, then you also can confirm by looking at the record of drug proving. हम जल्दी से drug proving का record निकाल के देख सकते हैं कि whether it is a symptom of this medicine or not. तो हमें पता चल जाएगा कि मेडिसिनल एग्रावेशन है या डिजीज एग्रावेशन है या होम्योपैथिक एग्रावेशन है. सो यू कैन इजिली डिफरेंशिएट. व्हाई? बिकॉज यू नो और यू हैव द रिकॉर्ड ऑफ द प्रूविंग ऑफ दैट पर्टिकुलर medicine. So you can confirm कि whether this new symptom that has come, whether it is the symptom of this particular medicine or not, and you can act accordingly. हम लोग एंटीडोट दे सकते हैं, और अगर ये होम्योपैथिक एग्रावेशन है तो you can wait. So like that. Then footnote, when perfectly selected homeopathic medicine is administered, then all other routine mixture of juices of plant and other ointments should be forbidden. ये सेम चीज हमने पहले भी रीड कर ली है कि सारी चीजें जिसमें कुछ भी मेडिसिनल एक्शन होता है खुद का, वो सब मिक्सचर ऑफ जूसेस, वो सब ऑइंटमेंट, those all those should be totally banned when you are taking a medicine. Then 275 is regarding relation between homeopathicity and smallness of dose. What is homeopathicity? It means similarity of your medicine. How much the medicine is similar to the disease condition. That means the homeopathicity. How much your medicine matches with the totality of symptom. That is the meaning of homeopathicity. So Hahnemann is telling for the suitableness of medicine, it depends on two things. First, your medicine should have homeopathicity, means greatest degree of similarity to the disease condition, and your dose should be small. And if you give too strong doses, then it proves harmful to the patient. जितनी ज्यादा डोज होगी उतना ही ज्यादा हार्म होगा पेशेंट को. सो इट इज डायरेक्टली प्रोपोर्शनल टू द अमाउंट ऑफ डोसेज यूज्ड. And homeopathic medicine, it precisely act on that part of the body which is already weakened by the natural disease. जिस पार्ट में डिजीज है उसी पार्ट में जाके होम्योपैथिक मेडिसिन एक्ट करती है. तो इसलिए जितनी ज्यादा लार्ज डोज होगी उतना ही ज्यादा हार्म उसी पर्टिकुलर ऑर्गन पे जाके होगा. So you should make it very clear in your mind that your medicine should be very similar and it should be smaller in size. कि अगर वो गलती से गलत भी हो जाती है तो हार्म उतना ज्यादा नहीं होगा अगर वो स्मॉल डोज में होगी तो. Then 276 is regarding harm caused by medicine that is directly proportional to the potency. So कितना हार्म होगा एक मेडिसिन से वो कैसे पता चलेगा? जितनी ज्यादा वो मेडिसिन सिमिलर होगी उतना ही ज्यादा हायर पोटेंसी में हम लोग देते हैं. एंड अ टू स्ट्रॉन्ग डोज ऑफ होम्योपैथिक मेडिसिन डज मोर हार्म. अगर हम सिमिलर मेडिसिन बहुत हाई पोटेंसी में देते हैं तो इट गिव्स मोर हार्म देन द मेडिसिन विच इज अनहोम्योपैथिक मेडिसिन. अगर हमने सिमिलर मेडिसिन दी है बहुत ज्यादा हाई पोटेंसी में, similar medicine in high potency, so it will do more harm than that medicine which is unhomeopathic. So that degree of potency is also directly proportional to the harm caused to the patient. For example, in old school they were using mercury for syphilis, and that is the specific remedy for syphilis because mercury के भी सारे symptoms वही है maximum which are produced in syphilis. So what they were doing? They were giving large doses of syphilis or large dose of mercury they were giving, और large dose of mercury देने से क्या हो रहा था? Patient was suffering from incurable mercurial maladies. इसका दूसरा नाम क्या है? What is the other name for this?
Mercury discretia.
Or there is a specific word that is used in aphorism 41.
Mass venereal disease.
Very good, very good. Masked venereal disease जिसने बोला है, very good. Masked venereal disease is the correct answer because वो भी same है. Masked venereal means the venereal disease was masked by the symptoms of mercury. So that is due to the usage of large doses of mercury for the treatment of syphilis. Another example he is giving chronic China malady जो हमने अभी परसों वाली क्लास में पढ़ा. That was being given for the intermittent fever. लेकिन बार बार उसका overuse करने से क्या हुआ? Patient developed the symptoms of China and that was known as chronic China malady. Also discussed in aphorism 235. Then 277 is regarding inverse proportional between similarity and size of dose. So higher the similarity, smaller should be the dose. This you should keep in mind. जितनी ज्यादा मेडिसिन टोटलिटी ऑफ सिम्टम के सिमिलर है तो हमें डोज को स्मॉल कर देना चाहिए। पोटेंसी बढ़ा दो लेकिन डोज स्मॉल। यू गिव 10 ml बट गिव 1 डोज। ऐसा नहीं है 10 ml के 10 डोज दे दिए, तो इट विल हार्म द पेशेंट। Then 278, how to determine the exact size of the dose? हमें ये कैसे पता करना है? So it is based on pure and accurate experiences and careful observation. ऐसा नहीं है कि हमने किसी बिजी प्रैक्टिशनर से जाके सीख लिया, इस केस में इतनी डोज देने चाहिए, इतनी पोटेंसी देनी चाहिए। नो, someone experience should not be your experience. You should verify others experience. This is what Hahnemann is trying to say. और dose कैसे determine होगी? That should be based on your personal accurate experiences, your careful observations. Then 279 is regarding size of the dose. How you will determine the size of the dose. So first thing we have already learned in previous classes also कि dose of medicine cannot be made so small. हम इतना small dose कभी नहीं बना पाएंगे कि एक aggravation ना हो. Why? Because our medicine should be similar and somewhat stronger than the natural disease. अब अगर वो somewhat stronger than the natural disease होगी तो slight aggravation is possible. Slight aggravation will be there provided 3 कंडीशन ये फॉलो होनी चाहिए। If immediately after ingestion of medicine body shows slight exacerbation of original symptom, कैसे ये हमें पता चलेगा कि slight aggravation हो रहा है? ओरिजिनल सिम्टम्स तुरंत इंक्रीज हो जाएंगे आफ्टर द इंजेक्शन ऑफ मेडिसिन। एंड ये एग्रावेशन ज्यादा है या नहीं है ये कैसा पता चलेगा? This aggravation should not destroy any important internal organ of your body. And during the treatment, other medicinal influences are to be forbidden. कोई भी ऐसी चीज जो एक्शन ऑफ द मेडिसिन को डिस्टर्ब करती है, all those disturbing elements should be removed from the patient's sight or patient's lifestyle. देन इसमें एडिशनल क्या है? कैंट डिराइव्ड हिज 7th ऑब्जर्वेशन। उनकी 7th ऑब्जर्वेशन क्या है? फुल टाइम एम्लोरेशन ऑफ द सिम्टम्स येट नो स्पेशल रिलीफ टू द पेशेंट। सो दिस पॉइंट स्पेशली पेशेंट को एम्लोरेशन तो है लेकिन जनरल कंडीशन इंप्रूव नहीं हो रही है। सपोज उनका नी पेन है, नी पेन में तो आराम है बट एज अ होल इफ आई आस्क द पेशेंट ही इज नॉट इंप्रूविंग। व्हाई? बिकॉज ही इज कंज्यूमिंग समथिंग or he is doing some activity which is interfering the action of the medicine. और क्या कंडीशन है केंट की 7th ऑब्जर्वेशन में? एक तो ये कंडीशन है why there is no special relief to the patient. एक कंडीशन ये है that patient is consuming something which interferes the action of the medicine. और दूसरी कंडीशन क्या है? Patient is having only one organ. Suppose there are 2 kidneys, so 1 kidney is destroyed. तो इसलिए हम कितना भी मेडिसिन दे ले, the medicine will not fulfill the action of the 2 kidneys. It can only keep 1 kidney healthier. So these are the 2 conditions related to the Kent's 7th observation. There will be amelioration, but there will be no special relief to the patient. The first condition is deterioration of some important organ. And second condition is patient is consuming something which interferes with the action of the medicine. Then 285th edition is regarding imponderabilia. What is imponderabilia?
some artificial substances से medicine prepare करना है।
Okay. Partially you are correct. Imponderable means something which cannot be measured. Which cannot be measured. That is the meaning of imponderable. So medicinal substances prepared from those sources which cannot be measured. For example, medicine prepared from moonlight. उसका नाम क्या है? Luna. Medicine prepared from sunlight. उसका नाम क्या है? सोल। तो such substances are known as imponderabilias. मैग्नेट से जो प्रूफ बनती है मेडिसिन, Magnetis polyambo, Magnetis polyarcticus. So these medicinal substances are known as imponderabilia. So size of dose should be reduced to such an extent that after ingestion it should be able to produce very slight homeopathic aggravation. ये लिखा है in the aphorism section कि इतना डोज को स्मॉल करना चाहिए कि जो भी होम्योपैथिक एग्रावेशन हो रहा है दैट शुड बी वेरी स्लाइटेस्ट। और इसके फुटनोट में लिखा है इम्पॉन्डरबिलिया के बारे में। And for potentization of medicine, Hahnemann has advised only 2 succussions instead of 10 succussion. 10 succussions क्यों उन्होंने बोला कि नहीं करना है in 5th edition? अभी पढ़ा है हमने इसी क्लास में। बोलो why he changed from 10 to 2 succussions in 5th edition? बस क्लास अटेंड करनी है इसलिए आ गए हो। No one is listening. Because from 10 succussions, the medicinal power was greatly enlarged. It was enormously enlarged. That is why instead of 10 succussions, he started to practice only 2 succussions. ये अभी पिछले aphorisms में पढ़ा है। Then 286th edition is regarding interpretation of Sheen symptoms, which we have already discussed along with 248th aphorism, 246. Then 281 is 248 है या 246? Please correct me. Sheen symptom
248.
yes, 248 6th edition. 281 5th edition is effect of smallness of the dose. What will happen if you are using small doses? So, however the robust the patient is, he will be affected by small doses. ऐसा नहीं है कि कोई बहुत हमारे पास हट्टा कट्टा पेशेंट आ गया तो हमें लग रहा है कि स्मॉल डोजेस से उस पर कुछ नहीं होगा। Small doses will affect that patient also. So you should not be confused in your mind even after seeing the robust patient. The small dose will act similarly on that patient also. So you should stick to the homeopathic principles. Then 281 6th edition is regarding the prescription of placebo. Whenever the homeopathic aggravation is seen, then you prescribe placebo because homeopathic aggravation is good. And homeopathic aggravation is due to which action? Primary or secondary?
Primary.
Yes, very good. It is due to the primary action. And after prescription of placebo for few days, if old symptoms totally vanish, then patient is probably cured. And if your disease still remains, तो क्या करना है? You have to give next higher potency of the previous medicine. So these are the directions which Hahnemann is given, and these directions are very useful for your clinic purpose. Then 282 5th edition modus operandi. तो अब कौन मुझे बताएगा? मैंने लास्ट क्लास में ये होमवर्क दिया था. What is modus operandi? कोई नहीं बताएगा तो बोल दो, कोई नहीं बताएगा, आई विल स्किप, इतना टाइम नहीं है. What is modus operandi of homeopathic cure?
Ma'am, like how homeopathic medicine work on a disease. So जो भी हम मेडिसिन देते हैं तो उसके जो नेचुरल डिसीज है हमारी बॉडी में, तो जो मेडिसिनल डिसीज होती है वो उससे स्ट्रॉन्गर और सिमिलर होती है। तो
Yes.
तो जब इस तरीके से तो जो मेडिसिनल डिसीज होती है वो स्ट्रॉन्गर और सिमिलर है, तो वो उस पर डोमिनेट कर जाती है। जो नेचुरल डिसीज है वो मतलब हट जाती है बॉडी से, और उसके बाद अब जो बॉडी में रह गई है वो सिर्फ मेडिसिनल डिसीज रह गई है।
Yes,
तो
very
वो
good.
वाइटल फोर्स अपने आप ही ओवरकम कर लेते हैं।
Very good. This is modus operandi. Very good. So let us move to 282 सिक्स्थ एडिशन, इट इज अगेन रिगार्डिंग द मोडस ऑपरेंडी, लेकिन यहाँ पे कुछ एडिशनल पॉइंट्स है. So if the first dose of medicine produces homeopathic aggravation, that means the dose was too large. In case of sixth edition, that means which potency? Which scale of
50
potency?
millisieverts.
Yes, 50 millisieverts.
Aligned
So if
potency.
you are giving 50 millisiemel potency and from the first dose homeopathic aggravation starts, that means the dose is too large. Why? होम्योपैथिक एग्रावेशन मेडिसिन खाने के बाद तो आना चाहिए, तो ऐसा क्यों हो रहा है? अभी तक तो यही पढ़ा ना, होम्योपैथिक एग्रावेशन इज अ गुड साइन, बट व्हाई हियर वी आर टेलिंग दैट द मेडिसिन इज टू लार्ज? इट इज 50 मिलीसिमल पोटेंसी, कीप इन माइंड. अब बोलो क्या आंसर होगा? बिकॉज इन 50 मिलीसिमल पोटेंसी फर्स्ट डोज से एग्रावेशन नहीं होना चाहिए. इन 50 मिलीसिमल पोटेंसी एग्रावेशन अपीयर्स एट द एंड ऑफ द ट्रीटमेंट एंड दोज आर नोन एज व्हिच सिम्टम्स?
Sheen symptom.
Sheen symptom.
यस. तो भूल जाते हो क्या बीच बीच में? पता तो सब कुछ है. व्हाई यू आर नॉट एबल टू आंसर? Then footnote to sixth edition is primary manifest. This is very important. ये previous year question है. Primary manifestation जब कोई भी chronic miasm का होगा, they require large dose of their specific remedy. Now you tell me what is the specific remedy for SORA, syphilis and psychosis?
Sulfur.
Very good. So for SORA it is sulfur.
This Thuja for psychosis.
Mercurius.
Yes, mercury for syphilis
Syphilinum.
and thuja for
And
syphilinum. किसने बोला है? वन किसने बोला सिफिलिनम? ओहोर.
Yes, ma'am. Sorry, ma'am.
सिफिलिस है तो सिफिलिनम कभी भी नहीं होगा, ये याद रखना. सिफिलिस से सिफिलिनम, ये राइमिंग वर्ड्स नहीं यहाँ पे खेलना. ये बहुत बच्चे गलत करते हैं. इट इज वेरी गुड दैट यू हैव सेड दिस इन क्लास, तो बाकी सबको भी हेल्प होगी. सो नेवर आंसर सिफिलिनम व्हेन यू सी सिफिलिस. It should be mercury. And for psychosis is thuja, and sometime alternated with thuja in alteration with
nitric acid.
very good
Maybe.
nitric acid. Nitric acid. Thuja in alteration with nitric acid. Very good. So you have to give large doses for primary manifestation of the chronic miasm. This is a PYQ, very very important. और अगर जरूरत पड़े तो you can give daily or possibly several times a day, only in case of primary manifestation. And fig warts that have existed for some time without any treatment, for their perfect cure, external application of the specific medicine with internal use is recommended. ठीक है. ऐसे warts जिसमें कोई भी treatment नहीं यूज हुआ है अभी तक, in those cases you can use external as well as internal medicine at the same time. तो ये दोनों line are very very important. Primary manifestation के लिए large dose of specific medicine चाहिए, and in which cases Hahnemann has advised both internal and external application at the same time? In cases of fig warts. Very very important. These two lines are very important, mentioned in 282 6th edition footnote. Then 283, benefit of smallness of dose if selection of the medicine would have been wrong. अगर selection wrong है और हमने small dose दी है तो क्या benefit होगा? Already I have told that vital force can itself tackle it. Why? Because the dose is very small. So vital force can itself remove that medicinal disease. Now 284 is regarding the effect of dilution on action of medicine. What will the dilution do, or how dilution will affect the medicine? So remember, action of medicine do not decrease in direct ratio to the quantity of medicine. Suppose इसमें this medicine is having 4 drops of medicine and it is having suppose 100 drops of water. This is the dilution. So the action of the medicine will not reduce 100 times. This is what Henneman is trying to explain. It is not in direct proportion to the quantity of medicine or the quantity of dilution. The action of medicine does not decrease in direct ratio to the quantity of medicine or to the quantity of dilutions. इसका एक छोटा सा footnote है. You just go and read that and you will understand. उसमें कुछ proportion वाला example दिया है. So just go and read. You will understand. If you don't understand, then you can ask me. Then 284 6th edition. इसमें क्या है? What are the other routes of administration of medicine? You know the oral route. So besides the tongue, mouth and stomach, what are the other routes of administration? It is olfactory route. और olfaction के लिए किसको thank you बोला है निम्न ने? What is the name of the doctor?
मैम ग्रिशलिच.
Yes, Dr. Gresslich. Very good. Then inhalation is other method, same as olfaction and inhalation, and enunciation or inunction. Sorry, inunction means rubbing the medicine against the epidermis of the skin. इसको बुक में वर्ड लिखा है rubbing in. Rubbing in word is used in books. Then footnote में क्या है? Very important. This footnote is very important. I have already discussed in previous classes also. So if the medicine is given to some infant, so it should not be given to the infant. The medicine should be given to the nursing mother, और nursing mother के breast milk से the medicine will act and provide relief to the infant. Then if you want to destroy the ill effects of the sora to the coming generation. So when the medicine should be prescribed? Medicine should be given in the first pregnancy. When the female will become pregnant for the first time, at that time you have to give antisoric medicine and probably in the first trimester when the organs of the baby are getting formed. So this type of treatment or this type of cure where you are removing the ill effects of sora, this is referred to as posterity in advance. Posterity in advance means giving the antisoric remedy to the pregnant mother in her first pregnancy. Then 285 5th edition is smaller dose. So dose can further be reduced by consuming the smaller volume of medicine. Suppose हम लोग पहले patient को बोलते हैं 1 drop लेना है. Now you tell him that you consume a part of 1 drop. So this is how you can reduce the dose of the medicine. Then smallest possible dose can be prepared by using poppy sized globule. Means opium के जो seeds होते हैं उतने size के globule use करने से smallest possible dose can be made. Very very important. Then 300 such globules should absorb 1 drop of medicine. और 6th edition में क्या बोलता है हैनेमन ने? 500 such globules should absorb 1 drop of medicine. So this is also very important. ये question भी आता है. Now come to 285 6th edition, that is inunction or rubbing in. So indicated medicine you can give it internally and side by side you can rub it to the external part like back and arm so that the cure will be hastened, cure will be fastened. और हमेशा rubbing in कौन से part में करना है? To the sound part of the skin. जहाँ पे cuts वगैरह है वहाँ पे हमें नहीं करना है. Then homeopathic physician never sends his patient for the mineral bath क्योंकि mineral bath क्या करते हैं? Suppress कर देते हैं. And while administering medicine through olfaction, Henneman has advised to use mustard sized globules. This is additional, not in this footnote. This is from the chronic disease. So olfaction के लिए कौन से size का globule use करना है? Mustard sized. Then 286 5th edition is adding medicine to small quantity of water before consumption. So this is a repetition. पानी में मिला के लेना है so that it touches more nerves. Then 286 6th edition is electrotherapy. So like magnets are used as medicine, electricity and galvanism can also act powerfully on the body. But इसको क्यों use करने से मना कर रहे हैं Hahnemann? Because their true effects are not known on the human body, because they are not proved, so their therapeutic effects are not known. And electricity and galvanism have also been used, but only for palliative purpose. ये line बहुत important है. Electricity and galvanism, they palliate, and palliation is harmful to the patient. And positive effects of both electricity and galvanism are little known. इसलिए थोड़ा सा known है, तो इसलिए पता है कि they palliate, and palliation is harmful to the patient. Then 287 fifth edition is mixing of medicine with a diluent. So before ingestion, उसको water में mix कर दो. Again same thing, and it should be thoroughly mixed. Footnote पे आ जाते हैं डायरेक्ट. To raise the power of medicine moderately, what you can do? You can give 2 downward succussions. So 2 jerks में power of medicine is increased. Then for solid substance, trituration is done for 1 hour. ये याद रखना है. And regarding the exact process, it is discussed in pulsatilla and arsenic in Materia Medica Pura. इसका एक second footnote भी है. Higher the dynamization, more rapid is the action of medicine, and more penetrating is the power, and shorter is the duration of action. जितना ज़्यादा डायनामाइज करेंगे, रैपिड एक्शन होगा, उतना ही ज़्यादा मेडिसिन पेनिट्रेट करेगी बॉडी में, बट एक्शन शॉर्टर होगा. Then 287 is regarding the use of magnets in 6th edition. So regarding the magnets, he has written under North Pole and South Pole in Materia Medica Pura. And the doses of magnet को हम कैसे modify कर सकते हैं? By the length of time of contact with one or the other pole. Suppose this is one magnet, तो इस पे painful part को ऐसे touch कर दो, तो जितने length of time के लिए contact पे रखोगे, उतना ही ज़्यादा डोज होगी. कम टाइम के लिए कॉन्टैक्ट में रखोगे तो डोज विल बी रिड्यूस्ड. तो दिस इज हाउ यू कैन मॉडिफाई द डोसेज ऑफ मैग्नेट. एंड फॉर एंटीडोटिंग, दिस इज वेरी इंपॉर्टेंट, हाउ यू विल एंटीडोट द magnet by using the polished plate of zinc. Very very important in 287 6th edition. And in Materia Medica Pura, this is an additional information. Hahnemann ने कितनी magnets को describe किया? He has described 3 magnets. Magnetis polyambo, Magnetis polyarcticus, this is North Pole. Magnetis polis australis, this is South Pole. And this is the full magnet. Then 288 5th edition is regarding olfaction. Medicine in liquid form acts most rapidly because it touches more nerves. It has more penetrating power. लेकिन footnote में है olfaction के बारे में. How the olfaction should be done. So medicine act powerfully in olfactory method also. And medicinal globules retain its medicinal properties for at least 18 to 20 years. This is also very important. ये आता है. Globules की पावर कितने साल तक रहती है? For 18 to 20 years. Olfaction के लिए mustard side globule यूज करना चाहिए. And 284 में olfaction के बारे में वहां पे भी दिया है. Then 288 and 289 are regarding the mesmerism. Animal magnetism is also known as mesmerism. And mesmerizer क्या करता है? Mesmerizer is the person who does mesmerism, and he distributes the vital force equally over the whole body. What are the qualities of mesmerizer? Very important. Strong-willed person होना चाहिए. He should be well intentioned. उसके गलत intention नहीं होने चाहिए. He should have good intention. He or she should have very moderate sexual desire and philanthropic attitude होना चाहिए. Means the one who works for the welfare of the society. And footnote में क्या है? Again, mesmerizer possess qualities of mesmerizer. He should have strong will, well intentioned, very moderate sexual desire, और ये वाली जो quality है, this is written in footnote. And he should have a philanthropic attitude. That means he should be a person who always works for the good of the society, for the welfare of others. Then mesmerism was given by Mesmer. ये क्वेश्चन आता है, who is the originator of mesmerism? Mesmer, and it was added in 3rd edition. Mesmerism was added in 3rd edition. ऐसे एम होता है ना, इसको रोटेट कर दो, 3rd edition, कभी नहीं भूलना है. Then 289 5th edition. All sensitive parts of body can take medicine even if your nose has lost the smell power, the smelling power. एनोस्मिया हो गया किसी को या हाइपोस्मिया होगा, फिर भी अगर उसको olfactory route से medicine देंगे, then also the medicine can act. So every part of the body जहाँ पे भी sense of touch है, means जहाँ पे भी skin है, that part can take the medicine and the medicine will act. So same thing is written in footnote. Then even if the person has lost the power of smelling, even if the person has started to suffer from hyposmia or anosmia, then also the medicine can be given through olfactory route. Then 289 6th edition is regarding the positive and negative mesmerism. So 288 6th edition is regarding the mesmerism, qualities of mesmerizer, and 289 is regarding, in the 6th edition, it is discussing the types of mesmerism, positive and negative. What is positive? Influx of vital force into the patient, means there is deficiency of vital force and you are influxing the vital force into the patient, that is positive mesmerism. How should it be done? By moving the hand slowly, the palm of the hand, ठीक है, palm of the hand slowly from top of the head to the tip of the toes, and it is given in deficient vitality. As I have already told, patient में vital force की कमी है, so you are influxing, you are infusing the patient with vital force. For example, in cases of old ulcers, amaurosis, paralysis of single part. Then just opposite to it is the negative mesmerism. Negative में क्या करते हैं? Positive में हम slowly कर रहे थे, negative में rapid movement of head from head and to the tip of toes. And negative कब देते हैं? जब किसी एक organ में बहुत ज़्यादा vital force accumulate हो जाता है. When there is accumulation of excess of vital force or excess of energy in some one particular organ. For example, एक healthy woman है, उसके sudden suppresses of menses हो गए. So that means all of the vital force has accumulated inside her uterus. So this sudden suppression of menses has led to violent mental shock and she was relieved by negative mesmerism. So uterus से निकाल के सारा vital force is distributed in the whole body. So it is to drain the excess of vital force. प्रोसेस कैसे करना है समझ में आ गया. स्लो करना है पॉजिटिव में, रैपिड करना है नेगेटिव में, दोनों में ही फ्रॉम हेड टू टो. Then how to give mesmerism? Moving flat extended hand from head to toe, parallel to the body. ये body है, so your hand should be parallel. ऐसे मूव करना चाहिए from head to toe. And hands और body के बीच में कितना गैप होना चाहिए? 1 inch. And the mesmer should not wear silk in any part. ये point important है. Then 295th edition is parts of body other than mouth, जहाँ पे हम other than mouth and nostrils जिसके थ्रू हम मेडिसिन दे सकते हैं. So this is again repetition: stomach, mouth, interior of nose, rectum, genitals and parts where skin is absent. अल्सरेटेड या wounded spots में भी हम मेडिसिन दे सकते हैं. Then 296th edition is regarding massage. So massage किस में देनी है? The patient who have been cured but they cannot recover from the loss of energy, या फिर chronic disease है, ठीक होगी लेकिन उनकी digestion की problem ठीक नहीं हो रही, भूख नहीं लग रही है या फिर नींद नहीं आ रही है, so they are slowly convalescing. उसकी जो vital energy है वो वापस restore नहीं हो पा रही है. The natural disease has gone but the vital energy is not coming to the previous level. So in such cases, you have to give massage. So in slow convalescing cases, massage is required. Massage revives such patient, and massage का जो principle है, it is same as that the principle of mesmerism. लेकिन mesmerism में touch नहीं करते, massage में touch करते. This is the only difference. And to the hypersensitive patient, massage should not be given in excess. So it will harm them. Then 291 is in the 5th edition, senseless part can also communicate power of medicine. Same कि अगर किसी को sense of smell चला गया, then also olfactory route से through the nose the medicine can be administered. Then 291 6th edition is regarding bath or mineral bath. So baths are palliative. They are acting partly as homeopathic and partly as palliative. So in acute disease and in convalescing patient who are cured from chronic disease, उसमें bath दे सकते हैं. But they are not true medicine because they are palliative. Warm bath का temperature और cold bath का temperature ये आता है. वार्म बाथ का टेम्परेचर कितना होना चाहिए 25 डिग्री टू 27 डिग्री आर. आर मीन्स रैंकाइन. दिस इज अनदर यूनिट फॉर टेम्परेचर. फॉर किस में देना चाहिए वार्म बाथ? फॉर फ्रोजन केसेस, फॉर ड्राउनिंग केसेस, फॉर केसेस ऑफ सफोकेशन. कोल्ड बाथ शुड बी गिवन इन केसेस ऑफ restoration of muscle tone and the temperature should be between 10 to 6 Rankine. Then 292 5th edition is external surface of skin is also susceptible to medicine. So you can also apply the medicine in the liquid form to the external surface of the skin, and most sensitive part of the skin is most susceptible, and most sensitive as described by Henneman is the inner area of the thigh or the medial aspect of the thigh is the most sensitive part. 293 और 294 5th edition में क्या है? Mesmerism, which we have already discussed as 288 edition of 6th edition and 289 of 6th edition. So this completes your today's class as well as your organon syllabus. Okay. Thank you and good night, and we will meet in another class with new subject.